I am your host. Now, today we have a very special doctor in the house. Yes, another doctor in the house. Her name is Dr. Humeira Badsha, is a consultant rheumatologist. She is an American board certified in rheumatology and internal medicine and certified in the musculoskeletal ultrasound. Well, welcome to the show.
Thank you,
Dr.
Belynda.
Humeira.
Thank you for having me.
Kindly tell the audience what is your role and what is your job.
Well, thank you. And not many people know what a rheumatologist is. They say, when they see me, they say, that's the first time I've heard of a rheumatologist. So a lot of people think that rheumatology is something to do with this rheumatoid arthritis or bones and joints, but it's actually far more than that. We deal a lot with autoimmune diseases where your immune system gets overactive and attacks the body from inside. So there are thousands of autoimmune diseases. There is like skin diseases like psoriasis, vitiligo, there's juvenile diabetes, where little kids get diabetes. And then there's all these different 50 types of arthritis, including rheumatoid arthritis. And we take care of lupus, which is a condition which attacks the organs, scleroderma, and lots of things we've not heard of, thankfully.
Wow.
But it's very interesting. So why did I develop an interest in being a rheumatologist? I think mainly because it's really fascinating. It involves all parts of the body. People don't know that I'm taking care of people who have autoimmune diseases of the eye, of the skin. So one day I'm taking care of someone whose problems are in the eye or the lungs. So they've been referred to me by the pulmonologist or the ophthalmologist or other specialities because this immune system is overactive in that specific organ. So it's so fascinating because we have to put everything together, and sometimes it's like being a detective. We have to know all about the different organs and try to diagnose people. So it's not just there, it's not just routine. It's a lot of different things going on at the same time. And I like the intellectual challenge, I think of it. So it's a little challenging sometimes. So it's more interesting that way.
I think all our doctors loves an intellectual challenge. I've never met one that don't.
Yeah.
So as you say, you know, the patients that comes to you, the first thing, of course, they're going to relate to your skills. It's like, okay, that's arthritis. So how does you get autoimmune patients coming to you? How would a patient land up with you, and how does it develop?
Okay. So basically an autoimmune disease may not be like announcing its arrival. Here I am. So a patient, for instance, with the eye, we talked about the eye, there's a condition called uveitis. All this person has is a red eye, blurred, painful. They think they have conjunctivitis. They get some drops, they put it, they go to their local GP. Then it keeps coming about, blurring of vision. And there's inflammation in the middle segment of the eye. There are all these white blood cells which are rushing there and attacking the middle part of the eye. So when they see a specialized ophthalmologist, they'll say, oh my God, you have this autoimmune disease, and go see the rheumatologist. So they come to us, we run some tests, and then we start medication at that point. So we don't really know why people get autoimmune diseases. That's a little bit more tricky. First, people carry a genetic predisposition, like with every disease. For instance, with cancer, you might have a genetic predisposition to having this condition. And then there are triggers in the environment. You know, there is bad diet, there's stress. Stress is a very big one. There is maybe a virus trigger or something. Like, you know, now we have the COVID.
Yes.
And COVID, we're seeing is triggering a lot of autoimmune diseases.
Yes.
When you've seen people having the severe condition in the lung, that's actually the immune system going into overdrive with COVID and attacking the lung. So they've used, no one knows this, they've used a lot of rheumatology drugs. Drugs we use for rheumatoid arthritis to treat the lung disease in COVID. So actually lots of our medications went out of stock last year because of this, and when we were treating our patients, we had a tough time. But it's so fascinating because people don't know the link between rheumatologists and, you know, things like viral diseases.
It's very true. I mean, like you said before, I think rheumatology relates to the bones and the muscles, but it's such in depth. So tell us, why did you choose this specific area to study in and to work in?
So it's interesting because one, every doctor probably chooses out of interest and aptitude. You know you're good at it and you're interested in it. Then you have great teachers. I had great teachers in medical college in India who was like someone who was really interested in it. And then I trained in Connecticut, and you know, one of the leaders in rheumatology was there. And then I went to California, and I actually became a rheumatologist there. But also my mother had crippling rheumatoid arthritis. I entered medical school, I think, when I was 17, like how we do when we're very young. And when I was 18, my mother started developing really swollen and inflamed joints. And so my mother, when I was in medical school and entered my first year, she started developing these swollen and painful joints and went from doctor to doctor. And this was a long time ago, almost 28 years ago. So there were not many medications or treatments available. And a person who was so active, wearing 6-inch heels and, really doing a lot of stuff. She was a fashion designer in those old days.
wow.
And being very active, had to become bedridden. And, it was a psychological impact, not just for her, but for the whole family,
Right.
where, your mother is, who's the center of the family, becomes so ill. So that was in the back of my mind. I didn't set out to say, oh, I'm going to become a rheumatologist because of her. But that was, of course, something which impacted me at a very young age. And then later, when I found these great teachers and people who displayed such amazing compassion to their patients, especially at UCLA in California, had the most amazing mentors, which really inspired me. People who were leaders in this field, but they not only were doing research and writing books on the subject, but when they came in front of a patient, that's all they cared about, the humanity of this person who's suffering. I mean, I don't care about my awards, my books, my whatever I did, but this person who's suffering in front of me. And I think that was such a great learning experience for me.
I bet. My mother has arthritis and severe arthritis.
I'm sorry to hear that.
Yeah, and I think sometimes the arthritis must be linked to osteoporosis as well. Now, for those audience out there who is looking for an answer for arthritis, I think a lot of us do. And I have this question for you: is that why does arthritis hit so hard during a rainy season or when the weather gets a bit cold? Does it have any effect on the body at all?
Yeah, so now we're going to learn a few terms, right? It's a little bit of medical jargon, but bear with me. There are about 50 types of arthritis. So there is one type which affects people as they get older called osteoarthritis, and that's the most common type. And that's why everyone thinks, oh, arthritis is something for old people. And yes, in that type of arthritis where it's a deficiency of cartilage, or the cartilage gets worn down and the bones get weaker and less dense, yes, in that type, the weather affects them, the cold affects them. Their muscles go into spasm, and they don't feel well when they're cold, and they need to warm up, and heating pads help them. Then the other types, which, as I said before, are autoimmune, and our listeners need to know the difference, because the treatments are so different. Because the autoimmune types are rheumatoid arthritis and lupus, and those need immunosuppressant medications. And interestingly, those get worse with heat and humidity. So it depends on what you have and how weather affects you. But yes, like in the old days, we used to think it's all jargon, it's all rubbish. This granny says, I can tell when a storm is coming. I can feel it in my bones.
I've heard of that too, yes.
But, it is true. We found now that changes in barometric pressure make the arthritis worse, and people can actually flare up during those times.
So if someone has a symptom, so for the watchers, the audience that's watching, what are some of the tips that you can give the audiences, like when you see this symptom, you need to come see me? What are some of the things that you can actually advise?
So first of all, persistent joint pain. If any of your joints keep hurting for a long period of time, you could be developing some form of arthritis. So don't self-diagnose, because a lot of people think, oh, it's just something in my joints, and let me just keep going. And they keep running with it, and they keep doing things, and they don't really pay attention. So if you have persistent pain, but definitely if you have swelling and inflammation, if your joints get swollen and inflamed, you need to be right with us right away. Yesterday or today, I had a patient in my office, a lovely lady, and she's very early in her disease. She only has one swollen toe, and she's there in our office, and we can go for very good treatments in an early stage of the condition.
So the swelling of the toe, you're saying, so it could be any parts of your body, fingers and so forth. And
we have 200 joints in the body.
For someone who doesn't have the medical experience like you do, or someone who's naive and ignorant, and they look at a swollen toe, I mean, it could be anything. So it could be, I banged myself on a cupboard. So how long do they have to actually watch it before they come to the doctor?
Couple of weeks.
A couple of weeks. Yeah. So if it persists for a couple of weeks, you shouldn't be sitting at home.
Yeah, exactly.
This is more focused for women, and I love to address it for women, because I love women in a whole. Is that some of the common rheumatology problems for women? Is it specific, or is it non-gender specific?
Actually, you're right, Belynda, that a lot of arthritis affects women disproportionately more.
That's interesting.
So there is an interplay of hormones and genetics into that. But also, I think there's some types of arthritis, for instance, rheumatoid, which is very much triggered by stress. And we find women being stressed more and more in modern day life because they're working outside the home, they're taking care of kids, they take up more than they should.
Yes.
I think sometimes they take up more than their bandwidth. They don't ask for help. And that's the first thing I say. You have to ask for help and take care of yourself first.
Yeah.
Like in the flights, in the plane, they say, put your oxygen mask on first before
Yes.
helping your kids. And they're always like, oh, I have no time for exercise because I have to do this, this, this. I have to wake up and I have to make my kids lunch boxes and I have to do homework with them and I have to sit with them. And, you know, there's so many things people say. But I'm like, have you ever asked your husband for help? Have you ever said, let's get someone in, a tutor maybe? Have you ever asked for these things to reach out to people? So I think it takes more than just one person to raise kids and, you know, people or to manage a home or to raise kids or to do it. But I think women like to take on sometimes a disproportionate amount of responsibility and stress and do all the heavy lifting, and those really can lead to a lot of stress-related illnesses. So, you know, watch that.
I mean, the world's changed so much. We encounter a world that's opened and free. Now we're so restricted. And whether it is at home or at work or traveling around the world, everything seems to be so different.
Right.
And you're right, stress is the cause of rheumatology. My goodness. Then,
I mean, it's one of the contributors, definitely one of the triggers.
and would it be the main triggers?
In some people, it is. I had a patient who, when I was in Boston working, she was perfectly healthy. And then she comes, this was in 2003, I think. Her son was just deployed to the Gulf War.
Yes.
He was a soldier in the army, and she never thought he's going to be sent actually to the front lines. And that stress just triggered her. She developed every joint in her body swollen, and it was just like a storm of, nothing else happened to her. It was just the sudden stress of, you know, emotional stress which she had.
So that could be a quick trigger of rheumatology. Now, is it genetic?
It could be a quick trigger or it could be chronic stress. People chronically dealing with some stressful situations in their life, or even how they approach stress. It's not just stress. Like a lot of people have stress, but it's how your approach to it is. You know, what you feel about stress. So.
Now, you're the third doctor in the set in Spotlight that actually talks about exercising.
Yes.
And every single doctor that sits and talks to me goes, you need to exercise, you need to work your body, you need to be healthier, eat healthier. And I think that is probably, I would say, the main medicine to be having a healthier body. Now, let's go back to rheumatology. Is it genetically linked?
Yes, absolutely. There are definitely genes linked to all types of arthritis. And if you're genetically predisposed to it, then you have to limit your environmental triggers like overweight, lack of exercise, smoking, eating the wrong foods, and we can talk about that more, a lack of, you know, and having chronic stress and infections, triggers like viral infections can all trigger all these things. So even bad dental hygiene, people who have chronic gingivitis, it is linked to developing arthritis later. So these are some things you can do to limit your risk. If you feel like somebody had arthritis in your family, how do you limit your chance of getting it? It could be.
Wow. So dentistry, like having bad teeth can link to
arthritis.
Having arthritis.
Because there are bacteria there, and bacteria can then trigger your immune system, and your immune system is triggered, and then says, oh, what am I doing here? Oh, let's attack the joints.
Oh my goodness, that's fascinating. That is totally fascinating. Now, I have been with association with a lot of doctors and pharmaceutical company that is supplying supplements, and they say, you know, if you take supplements, all your problems are going to go away. Now, I know we chuckle a little bit with that. What are your thoughts on that?
No, absolutely not. I mean, your problems are not going to go away with supplements, but you have to approach this in a holistic manner. First, look at your food. There's a lot of junk we're putting in our bodies, the number one being sugar and all the hidden sources of sugar. I mean, everyone says, I don't eat sugar, doctor. They mean that they don't take a teaspoon or a couple of teaspoons of sugar in their coffee, but they're eating sweets, they're eating cakes, they're eating cookies, they're having biscuits, they are then eating a lot of ketchup or other sauces which added sugars, then chips and all sorts of other foods, and juices. too much of fruit juices, even if it's natural, that has a lot of natural sugar, which is also, I mean, not bad as far as autoimmune, but it's bad for your weight. So people have a lot of hidden sugars which they're not aware of, and drinking Coke and Diet Coke, those are the worst inventions on earth.
Coke and Diet Coke, I heard that there's 60 teaspoons of sugar in a cup of Coke.
Yeah.
Believe it or not.
And Diet Coke doesn't have sugar, but it has chemicals. And funnily enough, the studies have shown that people who consume Diet Coke actually put on more weight than people who drink regular Coke, because of the chemical reaction triggered in your body through those additives.
Interesting, interesting. So what you put in your body actually results to who you are and what kind of illnesses you have.
So we talked about food. So also with autoimmune diseases, we talk a lot about the anti-inflammatory diets, where you limit inflammation in your body through food. And we tell you a lot to stop eating sugar first. Nobody's going to like me. Dairy, because a lot of milk products, especially the protein in milk called casein, seems to trigger an immune response. And limiting gluten, because again, that protein seems to be not handled by the body well.
That would be the breads and the flours?
All types of breads.
Okay.
You can have like things which don't have gluten, like quinoa or rice, which have less gluten, but not the regular breads.
Okay.
So these are the things which normally trigger an immune response. And red meat.
Red meat?
Yes.
So someone who loves beef and
those have
lamb.
No, there's an increase in choline in the body, and that's a problem. So you limit your inflammatory foods, and that's good for all health issues, such as heart problems, cancer. You know, people talk, and then you add things which are good for you, like vitamin D. Make sure your levels in the blood are good if you're not spending time in the sun, because vitamin D protects your immune system. People think it's vitamin C, but it's actually
Vitamin D,
which protects your immune system. It protects you from infection risk. It protects your immune system from autoimmune conditions. So you really need a lot of vitamin D.
Oh my goodness, you are correct. You are so right about that. And lately, in the last few years, I've heard nothing but vitamin D.
Yeah.
How the good sources that it's actually helping the body.
Yes, exactly. And a lot of people are vitamin D deficient because we don't spend time in the sun, or if we do, we wear sunscreen. And that blocks out the vitamin D, the ultraviolet
in
light.
Dubai, there's a lot of sun.
Yeah, but we don't go out there, right? We're sitting in a studio, and
That's true.
Yeah.
That is true. That is true. Now, you are definitely very into eating well, you know, making sure you have the right diet, and you've recently authored a book.
Yes.
Yeah, tell us about this new book. It's called The Wellness Guide.
So I wrote this book to benefit the Middle East Arthritis Foundation, which is a foundation which supports patients with these chronic illnesses like arthritis and supports them in their journey. But we find that a lot of times you come to the doctor's office, the doctor has 20 minutes with you, he has to write prescriptions, he has to look at your blood work, he has to make sure you're okay, he has to check you. And there's so many things happening. Nobody can really sit down and talk to you about your diet, how you need to exercise, and your whole journey as a person. You know, you go back home and you have all these questions, and I've had so many questions in the last 30 years. So I sat down and wrote this book, but I wrote it with some other experts in the field. I have a nutritionist who wrote the chapters on nutrition, and I had some experts in yoga and Pilates, and even chapters from patients on how they can take control of their condition, health coaches, being positive when you have a chronic illness, how you can actually, try to improve yourself and what you can do for yourself. So the book is called The Wellness Guide to Arthritis, and it's meant to benefit anyone who has arthritis.
And is it a book that has a step-by-step guide?
Yes, absolutely. So there is the first section relies on just talking about arthritis, what we talked about, what it's about, all the different types of medication used. And the middle section is all about diet, including recipes, lovely recipes devised by the nutritionist to be gluten-free, dairy-free, and really something which will give you your immune system the rest it needs and the kind of support it needs.
Now, I want to ask you a side question here. I used to attend a hospital in Mexico, and it's a holistic hospital. And the doctors did say, reduce on your gluten, It is no longer the same as it used to be.
Absolutely.
Now, I want you to expand on that a little bit. What does he mean when he says, your wheat is no longer the same as the wheat that you have 30, 40 years ago?
Absolutely. So everyone says, why is everyone gluten intolerant?
Right.
So, there's a problem with gluten that some people have a specific autoimmune disease called celiac disease where the gluten attacks the intestine. But there's a whole group of other people who are developing other types of autoimmune diseases like arthritis or even just gluten intolerance, a lot of gas, bloating, acidity. And they're like, why do I always feel so bad? And it's because of these foods. Now, why? Why didn't it happen with our parents and why is it happening now?
Right.
It's because, first of all, the wheat is so genetically modified now. It's completely different from what we used to eat. So there's GMO everywhere. The second thing is it's processed. It's processed in these huge industrial processors where they're releasing 30% to 40% more gluten in your wheat products than you had before. So our body is just not evolved fast enough to keep up with that and to process all those proteins which we're not supposed to be having in our body.
Thank you for that explanation. I think a lot of us don't see the difference between now and what our parents used to have.
Absolutely.
Things have changed so much. The world have changed so much. Our soil has also changed a lot.
Absolutely.
Yeah, and we're constantly pumping up more and more food at a quicker pace to feed 7 billion people.
Yes, so when we talked about supplements before, and I didn't really cover it because I first wanted to focus on eating healthy.
Yes.
And when you eat healthy, you work for your gut microbiome. You have 1 trillion bacteria in your body, 1 trillion. It's like the deficit of some countries, I think. And these trillion bacteria do a lot for you. They produce hormones. They help you with producing vitamins. They help with digestion. They help your immune system. So when you eat the wrong foods, the bad bacteria proliferate. And when you eat the right foods, you have a better mix of bacteria in your intestine. So first is food, eating a lot of vegetables, fiber, all of this, getting rid of those inflammatory foods we talked about. Then you may still be deficient in something. So vitamin D is the number one thing people are deficient in because that's not really in food. That comes from exposure to the sun. So it doesn't come from the sun. We have vitamin D in our skin. And then the sun activates that vitamin D. So we are born with vitamin D. Like we have the precursor to vitamin D, and it's in active form in our skin, and then the sun activates that. So that's not really a vitamin. But apart from that, besides taking a supplement for vitamin D, you may be deficient in omega-3. So when people take supplements, they should be taking omega-3, not omega-3, 6, 9. Because 6 and 9 are pro-inflammatory and 3 is anti-inflammatory. So a lot of supplements come as omega-3, 6, 9, and that's absolutely the wrong one to have. So omega-3 is there in salmon and fish and walnuts.
Yes.
And omega-6 and 9 is found in oils and certain types of fried foods, and those are not things you should have. So omega-3 may be a good supplement to have. A B complex if you're vegetarian, especially if you don't eat a lot of animal products. So these are and calcium. If you're not taking dairy, a calcium supplement. So that's all you need. I don't think you need a whole lot of other stuff.
Calcium C, A, B, antioxidants, the AOX.
I think if you eat right.
Yes.
Yes, there is a point about our soil is depleted in nutrition and our food. The theory is that our food doesn't have enough nutrition that we need.
I've heard of that, yes.
So a good multivitamin should take care of most of those problems. But you'll see that if you take enough calcium and vitamin D and, maybe an omega-3, you'll see the results in even your hair and nails will be better. And so that'll reflect on your bones, obviously.
Oh, wonderful.
Yeah, your skin.
Wonderful.
Yeah.
So always remember that, what Dr. Humeira is saying, all the necessity vitamins that you need to take. Now, you mentioned about the omnipresent in Dr. Google.
Yes,
Okay. Yes, and what are the issues you have faced with patients Googling their disease? I know everybody thinks that I don't need to see the doctor. My doctor's on a computer. I can just Google it and know the answer. So
life's become so hilarious now. I mean, sometimes you want to cry, sometimes you want to laugh. You don't know what to do some days. It's just like every day we have a story about people who have learned something on Google.
Yes,
and recently I had a patient who actually called, like I prescribed vitamin D for her because her levels were really low. So she went back, and 2 days after taking it, both she and her husband took it, and they developed a fever, a high fever. So they call and tell my nurse, she gave us this, and we read on Google that vitamin D can give you a fever. And I'm like, in my 30 years of experience, I don't know this. And she insists, no, I read it on Google. So I said, no, it doesn't give. So I'm like, can you please do a COVID test? And she's like, I don't have COVID. It's your vitamin D capsule. So it's hilarious. And then finally she does the test and she has COVID, and she and her husband have COVID. And I'm like, okay, I'm just the doctor. What do I know? Google knows better. So it's like this every day. We have some situation like this where people are getting misinformed. I mean, that's just an extreme case.
Yes.
But a lot of people read. I mean, it's good if you read a bit and you empower yourself.
Yes,
But if you
yes.
want to get all your diagnosis, then don't go to the doctor, because you're just getting misinformation. But sometimes it does help. Google helps to guide people to the right doctor.
Yes.
So one lady, I remember, I said, how can I help you today? She said, I have erythema nodosum. So I said, oh, wow, okay, did some doctor diagnose you? She says, no. I took a picture of my rash on my leg, and I uploaded it on Google image search, and it told me I have erythema nodosum and I need to see a rheumatologist. And she was spot on. Yeah, so Google was really right in that case. So I gave it to Google. But then sometimes, like, my son wakes me up in the middle of the night when he was 16. He said, Mom, I have leukemia. I'm like, what? He said, I have bleeding gums. And I Googled it and it says I have leukemia. So I'm like, no, it's just that you'd have poor dental hygiene. Go brush your teeth properly.
Oh, Mr. Google, Dr. Google, Master Google,
But
PhD
who doesn't
Google.
do it now? Everyone does it now.
Everybody does. It's because it's so convenient.
Yeah.
I mean, I have a question this morning, and the team was like, "Let me Google it."
Yeah.
And yes, it is very convenient.
Yeah.
However, I won't take everything from Google. I mean, some of the information there are not accurate, and you really have to do your research. But I think for illnesses and anything, if you have a symptom, it's best to visit a profession.
Yeah, you maybe need to also do your research on whom you're visiting, check their bio, check their references, check their reviews, and make sure you're going to the right person, and then trust them. Because, then if you don't trust them, take a second opinion, but don't keep going back to the internet, because internet will be one day great. But right now, it's not still set up to, put your concerns in the proper order.
Right. I like what you say is that when you do find someone, trust their opinions. And it's no point going to a profession. You don't trust them. You're going to Google. Not only are you wasting time, you're wasting money, you're just wasting a lot of your
energies.
So do that. Now, you are the founder of Middle East Arthritis Foundation, which is so impressive. And how and when did this come about, and what are some of the main activities that you do?
Okay, so I moved to the United Arab Emirates in 2005 from Boston. And I found that there was lack of awareness of arthritis. I mean, no one knew anything about a rheumatologist, and there were very few rheumatologists in the country then. I think there were just 3 of us in private practice, and now there are like 50. So things have really changed. But what I found is people were coming at very late stages of disease because they hadn't been diagnosed, or they were really scared of medication. There was a lack of awareness of both the treatment and the condition. So I was like, oh my God, why was this person here after 10 years with these deformities and damaged joints? So we tried to increase awareness, and we found that we needed to do more. So we set up the Middle East Arthritis Foundation to increase awareness. And also at that time there was no insurance for people,
For arthritis?
No, like people just generally did not carry insurance. Most people paid cash for their illnesses.
Yes.
And a lot of people just couldn't afford treatment. I remember my second patient in the UAE was a gardener. And the cost of his medication itself, just an ordinary medication, would be 300 dirhams. And he was earning at that time 600 dirhams or something. And it was hard. So I think people like them needed to be helped. So we started the foundation, and we actually paid for a lot of patients' treatments, their biological injections, all sorts of expensive treatments, as well as knee replacements. We did some surgeries. We sent some people for surgeries. And that was great. And then people started developing insurance. So we moved more towards just awareness building, focusing on patient support programs, and that's what we do now. And now we have a lot of doctors who work with us on board, the rheumatologists and orthopedic doctors. We have nutritionists, we have physiotherapists, and we have a lot of information we can get to people, either through our social media channels or through or through our direct programmings, which we do every year.
So since you have actually begun this foundation, how many members do you have so far?
We don't really count members because it's a very fluid situation, and the UAE people come in, they join, then they leave the country. So we just have followers on social media, and then we have the doctors who bring their patients in who are still in the country and still available every year, who come and go.
Yes, there's so many expats here. Did you not say that there's 90% expats that lives in Dubai?
80%. 80 to 90%, yeah.
Oh, wow.
Yeah.
Oh, this is one of the countries that's a little bit different from everywhere else in the world.
Yeah.
So last year you released a book.
Yeah.
Which is the Wellness Guide. You touched on it, you
Yes.
talked a little bit about it. And you wanted to write it because, and how is it received so far?
We wanted to write this book because we felt like patients had so many questions about arthritis, about what they should eat, what they shouldn't eat, the things we just talked about. And doctors do not have the time really or the information to explain all that. And also doctors, we don't receive so much education on nutrition. Did you know that doctors have very little information on nutrition? We don't.
Very much so.
Yeah.
I think then you go to a nutritionist.
Yeah, so but we need to know what the patient is doing is correct. We need to also educate ourselves. So then I did a lot of research on education and worked with nutritionists and worked with them to bring about this book, which will give patients a more holistic answer to their problems. And people who have read it are loving it, and we've got really good reviews. And so we're really happy for that. Yeah, it's available on Amazon.ae. Yeah.
Amazon.aa, you can find that book. It's called The Wellness Guide. Yes. Now, we've actually talked about arthritis specifically on women. And we talked about the stress that trigger it. Are there anything else that the women need to know to take care of her health to prevent such issues?
Yes, I think we need them to know that one is they need to have enough calcium in their diet.
Okay.
But that calcium comes mainly from dairy products.
Milk.
So on the other hand, if milk has so many hormones now, and milk may have this protein casein which can trigger an autoimmune reaction, then you need to make sure you're supplementing and getting calcium from other sources like green leafy vegetables. Like one of the best foods, spinach, kale, has a lot of calcium. One egg has some calcium in it, fish. So you need to eat foods like that to supplement it, or take a dietary supplement so your bones are healthy.
Let's say that someone's watching the TV, is like, I want to be a rheumatologist. I just want to be that. So I want you to actually provide a very candid answer to anyone who's watching you right now. What is a general advice you would give people? Should they or should not they not enter this field?
So first of all, entering medicine. I think that's the first question. Should you be a doctor? So a lot of people, I have this whole thing to talk about that. So
great.
So the way we pick doctors
Yes.
is wrong, because we pick doctors based on who scores the highest marks, who's the top in the class, and that's not the way. I think we need to look at empathy. We need to look at common sense. Common sense is lacking, and if a person can solve problems, look at someone's problem-solving ability. A lot of medicine is first about caring about the person in front of you. You're like, this person traveled 1 hour, sat outside my office for half an hour, they're here, we have 20 minutes with them, and let's make these 20 minutes count. If you're going to be that kind of person who's going to care about the person in front of you and care about what they bring to you first. So it's empathy and really being present for the patient. And I think people who enter medicine are thinking about it as a field like business, or you're an accountant or a lawyer or a doctor. But I think doctors are nurses too. Being a doctor or a nurse is putting a lot of yourself personally out there, and you need to want to do that. So how do we measure that? When we pick medical students, I really think, I'm like really taken aback about how we pick people. We only pick them based on
their scores,
how they score. And they could be the most uncaring person who doesn't really care. So I would say first, if you want to become a doctor, first, make sure you like people. You want to be with people. You want to listen to their complaints all day long, because all day long people are talking to you about their complaints, but you can turn this into a really positive thing. If you have positive energy to give them, if you feel positive about life and you give them hope, it's going to be great. So you need to know why you want to be a doctor first. So with rheumatology specifically, it's a subset of internal medicine. After you train to be a doctor, you then have to subspecialize in internal medicine, which is a more in-depth study of medicine rather than surgery. So after medical school, you can go into medicine or a surgical specialty. So you go into medicine, so you do more cardiology, pulmonary, whatever, all the things. You go into intensive care, ICU. We have to do that full rotations for 3 or 4 years. Then you go into rheumatology for another 3 years, but then you focus on this specialty.
Yeah.
So it's endless, but it's worth it at the end of the day. I really love what I do. I think we make a difference in people's lives. It's like the best thing. You go home every day and say, yeah, I made a difference in a few people's lives. Not everyone. I can't say, oh my God, I cured everyone. But I can't pat myself on the back. But yes, even if you can't cure someone. I had a man in a wheelchair, lovely man yesterday. Obviously he's been a really important person who's beautiful, cultured and elegant, and he's in a wheelchair. And he's in a wheelchair for reasons which we can't cure. And he said, Doctor, I just have one question for you. Why am I in a wheelchair and how will I get out? And I didn't have an answer for him, but I talked to him about other things he could do. Like I said, look, your memory is great. Let's keep that going. He's elderly. I said, you need to read the newspaper every day. So he felt at least happy and empowered that he had something to look forward to or to do. And let's forget about the wheelchair. Let's talk about how good your brain still is and how you can still contribute to things around you and, take part and participate. Because I think you have to find something to give everyone. So.
Wow, that's a very great answer. Yesterday we talked to another doctor, and she says, actually, it starts with after 14 years of education. Nothing comes easy. Nothing comes easy. And a lot of times we feel that the female gender or the girls out there thinks that's not something that I can do. It's something that maybe men can do, but not what women can do.
Yes, I mean, I really feel strongly that women need to be told, young girls need to be told, if you're watching this, you need to be told that you can do all this. You can be whatever you want to be. You can be an astronaut, you can be a soldier, you can be a pilot, but you need to put in that work. I mean, the men put in that work too, yeah. Women of our generation had a little bit more challenges to get to the same spot. But women of the younger generation should not have those same challenges.
That's
they
correct.
should be more gender neutral or equal in the workplace now. And you can do it. It's just, I think, a limitation of our beliefs that if I have kids, then I can't do this. I won't have enough time to give kids. You can do it all. You can. It's just a question of organizing ourselves, getting help, and I said when we need it. There's a lovely book out there called The 7-Hour Week. Working the 7-Hour Week. Have you heard of this book? It's a bestseller. And it talks about, you need to focus on what you want to do in your life. So you pay yourself. Like suppose, doing your laundry is a task which you don't like and you spend 2 hours on doing laundry and ironing clothes. You outsource that. You pay someone to do it or you send your clothes to the laundry. So you have those 2 hours left to spend time with your kids, which you really want to do. Then you say, oh, I have to cook, I have to do this, I have to do that. You can't do everything and you can't enjoy everything. Finally, you need to be there for people. You need to be present. But if you're in the kitchen all the time, I mean, I'm not saying don't cook. I'm saying do it, but get help or organize yourself so you spend the least amount of time doing things away from people you need to be present for. Finally, you need to be present.
That's such a powerful comment that you say, people needs to be present. I think there's so many noises around the world that we are always distracted.
Yeah.
There's a lot of distraction in the world.
Yeah.
There's an opinion at work, there's an opinion in the family, there's an opinion by my husband, there's an opinion from the child, and the kids, there's opinions everywhere. When I was in our era, which is the previous generation,
We're not that old, but
I remember my mother say, why are you studying? Why are you going to school? You have 2 kids. Why are you even wasting your time?
Yeah.
Just be home with your kids. But I think you're right, in a lot of senses that in our generation, I'll bring our kids, it's totally different. It's like, do what you want to do.
Yeah.
You can do this. When you say that girls can be astronauts, yes, they can. They can be pilots. They can be soldiers. They can not just be doctors. They could be presidents. They could be vice presidents. They could build companies. So, I mean, the potential is endless.
Absolutely.
Yeah. By watching such an intelligent woman like yourself on this set, sharing your experience and sharing your knowledge too as well with the world is commendable. It's very commendable.
Thank
You
you.
actually, not just saying what you know, but actually showing the abilities and the potential of a female.
Absolutely. I really believe that women have endless potential. Don't let your thinking limit you.
Yes.
You know, you really have to
Yes.
think that you can do all these things.
Yes.
Reach out and do it. You know, nothing
Yeah.
should limit you. So,
Yes, that's so important, especially when, not only that, I think family support is really important. Being with people that are supportive of your decision.
absolutely, I think that's really important. Starts with your partner.
Yes.
And your partner needs to believe that you can do it, and it's also that he or she is an equal partner in this whole journey. And you know, you need to make that happen. That you ask for help when you need it.
Well, you have done so much. You have gone through your medical school. You have practiced your medicine in 3 countries. You're living in Dubai right now. You're a founder of an association, and you're determined. Where I see is you're extremely determined to get the knowledge out to as many people as possible. You've written a wellness guide that's on Amazon. So, what are your future plans? Where do you see yourself?
Well, I have to say, like in all those achievements, I think still at the bottom of it, I'd say the best thing is raising 2 wonderful young men. And I have to say that would be my best and main achievement. You know, like if you raise, as you spoke before the show, raising good, kind, moral people, I think, and I think that's a positive contribution to the world, that these people will go out there and take your values into the world. And I'm really proud of that. And I think going forward, I think it's just continuing to support right now. I mentor other doctors. I want them to succeed. So we have founded a little subgroup of our women rheumatologists, and we have fun. We dress up, we go to dinners together. We encourage each other to present in conferences. Like, I think a lot of times it's unbelievable, but some women are inhibited. So we say, okay, present a paper or do a talk to us as women in a separate and more supportive sisterhood. So we're mentoring some who are not so confident to come up and rise to their true potential, because their potential is amazing. They're so good. And it's just that they still a bit held back, bit shy or a little bit inhibited. So we're doing all those things. And where do I see myself? I haven't really thought of that question. It's an important question. I think I'm just going to build on what I've been doing in rheumatology. That's my field. Sometimes I think, why didn't I do emergency medicine? Because it's been so exciting in a day. Because you see these TV shows, people are rushing around, opening up hearts and stuff.
Rushing around. Emergency.
So I think I would see myself mentoring younger doctors, because I think and giving them the values of how they should interact and how they should take care of patients, because that's something I passionately believe in. Is to give the best care to your patient, is to be there for them and, you know, support them. Even if you don't know their diagnosis, you say, I don't know, and I'll look it up for you, I'll ask someone, I'll come back to you. And that's how we need to be there, because not everyone has had the experience advantage I had of having, as I told you, such great mentors throughout my medical education. And I'm really thankful to them. And, you know, I think like other people need to be mentored as well. So I'd like to be doing that,
Wow.
going forward.
Wow, wow, wow. Well, you've heard it from Dr. Humeira. I am inspired, not because she's a doctor, but just because of her as a person. She's not an individual that shows her knowledge, but an individual that wants to pass her knowledge to the next generation. So thank you for joining us today on Spotlight. And I want to say that I am as inspired as you guys watching the show, because as I interview these amazing ladies, I get a boost of energy to do better myself tomorrow. So you can find this broadcast on our social media and our Asira Academy. I want to thank Asira for sponsoring the show. And thank you for watching Spotlight again. My name is Belynda Lee, and I'm your host. And I look forward to seeing you at the next Spotlight with another amazing woman.
Hi, I'm Dr. Humeira Badsha. I'm a consultant rheumatologist in Dubai, and I'm here being spotlighted by Belynda Lee.